Welcome to Professional Role Transition. It is exciting that you've decided to begin your journey toward your professional advancement. You should be commended for taking this step. I'm sure you're ready. Let's get started. Returning to school is sure to take some adjusting, as many of you have other obligations, such as work, family, church, exercise, and even some fun times scheduled in your busy life. Returning to school can be a challenge, as you must learn to juggle many balls in the air. We are aware of the challenges you face and will provide support and resources to help you become successful in your academic journey. Again, welcome, and let's get started. We will begin this week's lecture with a brief overview of the course and the weekly topics that we will focus on each week during the course. Upon completion of this course, students will be able to discuss the past history of the nursing profession in order to understand how the profession has changed over its course of history. We will identify current trends in healthcare that impact the profession of nursing. On a professional note, you will become familiar with the regulations influencing your practice, such as your state's Nurse Practice Act and the professional nursing organizations available to the registered nurse. The large and varied number of career opportunities available for the baccalaureate-prepared registered nurse will also be examined. We will examine the stresses inherent in the nursing profession, of which undoubtedly we are all familiar with, as well as describe coping strategies that will make our practice more effective. It is important to know where you are headed, so the course will end with you identifying your personal and professional goals as you begin transition in this RN to BSN program. During Week 1, we will examine changes in society that promote the nurse's return to school and further education, identify strategies to assist in academic success, discuss professionalism and nursing, describe socialization to professional nursing, analyze elements and boundaries of nursing roles, and discuss the past history of professional nursing. During Week 2, the ethical and legal foundations of professional nursing will be examined. In Week 2, we will discuss how nurses can help clients clarify their values to facilitate ethical decision-making, explain the uses and limitations of professional codes of ethics, discuss common bioethical issues currently facing healthcare professionals, analyze ways in which nurses can enhance their ethical decision-making abilities, describe how nurse practice acts direct nursing, and discuss essential legal aspects of malpractice, informed consent, adverse event reports, DNR orders, euthanasia, and death-related issues. In Week 3, we turn our attention to the roles of the professional nurse as a health promoter, teacher-learner, and leader-manager. In Week 3, we will differentiate between health preventive or protective care and health promotion, discussing the essential components of health promotion and analyzing the nurse's role in health promotion. We will also describe the various teaching roles of the nurse and differentiate leadership from management. In Week 4, the roles of the professional nurse as research consumer, advocate, colleague, and collaborator are explored. We will discuss the trend toward evidence-based practice in nursing and healthcare and describe the nurse's role in evidence-based research. We will also discuss the relevance of political action to nursing, along with the nurse's collaborative role, competencies in collaborative practice, and factors that affect collaboration in healthcare. In Week 5, we examine our changing healthcare system and how changing healthcare attitudes and economics impact professional nursing. We will examine the issues of cost containment and access to healthcare as they affect nursing, differentiate the concepts of health, wellness, and well-being, and compare selected models of health. Factors affecting health status, beliefs, and practices will be explored, as well as selected issues related to nursing and healthcare economics. In Week 6, our focus will turn toward how a professional nurse practices in a culturally and spiritually diverse world. We will discuss components of culture pertinent to nursing care, describe barriers to cultural competence, assess clients from a cultural perspective, plan and implement culturally competent care. We will also explore spirituality as it relates to nursing and describe the influence of spiritual development of the individual across the lifespan. Discuss the influence of spiritual beliefs about diet, dress, prayer, and meditation, and birth and death on health and healing, as well as explore ways to assess clients from a spiritual perspective. Advanced nursing practice and the future vision of nursing will be explored in Week 7. We will discuss education for advanced nursing roles, differentiate among functional advanced nursing roles, including clinical nurse specialist, nurse practitioner, nurse educator, and nurse administrator. We will also describe the historical development of advanced practice nursing and discuss certification and regulation of advanced practice roles. Past events that have shaped and molded nursing will be explored, as well as projections of future events that will affect nursing as we identify anticipated changes in healthcare and nursing in the future. Our final week, Week 8, is devoted to concluding the course with final evaluations and assessments. Our course this week will focus on the role of professional nursing as an art and a science. Students will examine the role of the registered nurse historically, in the past, and in the future. Current trends in professional nursing will be evaluated. Each week we will cover different topics related to the role of the professional nurse. Some topics will be directed toward your personal and professional growth as you transition into your role as both a student and advanced nurse, while other topics will examine the role of the professional nurse, looking at the past, present, and future. You are entering this advanced role in an exciting time, and there are some wonderful opportunities available to the baccalaureate-prepared graduate, as well as those with more advanced degrees. This week, we will examine changes in society that promote the nurse's return to school and further education, identify strategies to assist in academic success, discuss professionalism in nursing, describe socialization to professional nursing, analyze elements and boundaries of nursing roles, and discuss the past history of professional nursing. This week we will start with chapters 1, 2, and 3 in your textbook. This first week is one of adjusting to the virtual classroom, meeting your classroom colleagues, and examining this journey you have embarked upon as you begin the journey to becoming a professional nurse. For some of you, the role of student will also be relatively new at this point in your career, and we expect that there will be some adjustments on both the professional and personal aspects of your life as you begin your transition in this RN to BSN program. The key terms you will want to focus on in your readings this week are role theory, models of transition, mentor, professional socialization, and standards of practice. Chapter 1. Beginning the Transition, Journey to Professionalism. Changes in society place new demands on nurses. An aging population results in older patients being hospitalized with more demanding health problems. The elderly are the fastest growing segment of our population. In 1992, 12% of the population of the United States was over 65. By 2020, it is predicted that 18% of the population will be over 65. Due to changing reimbursement practices, patients are hospitalized with higher acuity levels and are discharged earlier than ever before, needing skilled care in either long-term facilities or their homes. Our population is becoming increasingly diverse. The United States Census Bureau estimates that the nation's Hispanic and Asian populations would triple over the next half-century, and non-Hispanic whites would represent about one-half of the total population by the year 2050. New technology and scientific discoveries demand that healthcare workers continually change their practices. Protocols associated with evidence-based practice are constantly being revised. New diseases require a higher level of critical thinking and demands, as nurses are expected to integrate knowledge from a variety of disciplines. Changing views or perception of the roles of men and women may provide the impetus for many of the nursing profession's internal changes. There is a perception of nursing as woman's work or as a female-dominated profession. While nursing has traditionally been considered a woman's profession with a perceived gender bias, the Department of Health and Human Services, as well as the National Council of State Boards of Nursing, estimates nearly 6% of all nurses to be men. 13% of students enrolled in nursing school are male. There is evidence that male professional nurses earn more in compensation and are found in greater numbers in management positions than their female counterparts. There are a variety of educational levels to prepare nurses for professional practice. These multiple entry levels are not found in any other profession, and most importantly, entry into professional practice is not allowed with less than a bachelor's degree. Law, medicine, and physical therapy require graduate education. While lack of resolution to the educational issue continues to threaten and undermine nursing's continual steady development as a profession, educational requirements for nurses continue to shift, with a decline in diploma nursing programs and an increase in associate and baccalaureate degree programs. Nurses must be well equipped to handle the challenges of the changing healthcare environment. Critical thinking skills, effective communication, research knowledge, and teamwork are essential to professional advancement. Returning to school provides the professional advancement that nurses seek. It represents a commitment to goals of both professional and personal growth. Meeting those goals requires lifestyle and role changes. Many of you beginning their professional nursing studies may be returning to school to pursue a second career in nursing. You may have been away from the academic setting for many years. Registered nurses returning to school may have been away from a formal education setting for some time and are anxious about becoming a student again. Fitting into academia represents a substantial transition from work and practice roles. Because many of you continue to work, the nurse must become comfortable about fitting into both worlds. Concerns about academic skills such as library searches, scholarly writing, and test taking are often a source of stress. Blending the student role with the work role and the family member role represents great challenges. Learning to deal effectively with the stressors that create barriers to success is important. Some of those barriers include managing time effectively to meet the commitments of family, work, and school, finding the financial resources to pay for tuitions, books, and educational supplies, finding and maintaining effective social support systems, including family work colleagues and student colleagues, learning to work with faculty who require academic excellence in spite of the many demands on the nurse student's time, and developing effective study skills. Time management skills are a necessary tool for survival and success. Organizing, planning, and setting of priorities are keys. Students will need to learn how to balance school, family, work, meals, sleep, exercise, spirituality, and personal time. For students returning to school, money to pay tuition and fees and to purchase textbooks and other supplies is often a concern. Many employers provide tuition reimbursement as a benefit of employment. Many civic groups and nursing organizations provide scholarships. There are a variety of programs available. Although students can be successful on their own, the support of others can make things go more smoothly. The people who can contribute to the success of students include their families and friends, their classmates, and faculty. The faculty is an important resource in increasing knowledge, expanding ways of thinking, and enhancing professional capabilities. Faculty are not the enemy. They are there to help you graduate. It is important to remember to use faculty while remembering that they are also people. Study skills are important and may need to be reviewed and enhanced. Take advantage of the numerous resources available. Seek help before you have a big problem. Students need to plan well to balance these many obligations that they have. Chapter 2. Socialization to Professional Nursing Roles. Socialization is a lifelong process by which people become functioning participants of a society or a group. It is a reciprocal learning process that is brought about by interaction with other people and establishes boundaries of behavior. Socialization to professional nursing practice is a process whereby the norms and values of the nursing profession are internalized in the nurse's own behavior and self-concept. The nurse acquires the knowledge, skills, and attitudes characteristic of the profession. Socialization for professional nursing requires the development of critical values, including a strong commitment to the service that nursing provides to the public, a belief in the dignity and worth of each person, and a commitment to education and autonomy. The process of professional socialization and resocialization is ongoing and does not terminate with graduation or start of a new job. Socialization into professional nursing has been challenging because of the different educational routes available. Controversy exists as to the appropriate level of entry into professional nursing, although professional organizations have stated that the baccalaureate level at entry level would enhance the profession. Nurses must understand the roles they and others play and the societal expectations associated with those roles. Any role consists of three elements: the ideal role, the socially prescribed or agreed upon rights and responsibilities associated with the role; the perceived role, how a person believes he or she should behave in this role; and the performed role, what the person actually does. Role performance is influenced by such factors as health status, values, and situational pressures. 5 determinants form boundaries for nursing roles: theoretical and conceptual frameworks, the nursing process, standards of nursing practice, Nurse Practice Acts, and international and national codes of ethics. Each of these will be examined in detail as we progress through the course. Nurses are prone to role stress and strain for a variety of reasons unique to their role in the healthcare and social systems. Common problems are role conflict, role ambiguity, role overload, and role incongruity. Strategies to handle role stress differ from strategies to manage role strain. Such strategies include priority setting and time management, along with rewriting job descriptions for clarity. Nurses can positively influence their self-concept and role images to improve work satisfaction and provide quality care. Developing a personal plan with achievable individual and professional goals will help to ensure success. Personal goal setting is needed with both long and short-term goals set. Identifying key strategies to enhancing team performance and problem solving as conflict arises will help ensure a positive experience. You will notice we have placed emphasis on socialization into thinking and acting as a registered nurse. At this point, you will want to ask what is different about professional nursing and how your role as an RN with an associate degree differs from that of a baccalaureate prepared RN. This is also a good time to ask yourself what might prevent you from meeting your goals and consider strategies for overcoming those potential barriers. Chapter 3. Historical Foundations of Professional Nursing. This first week will help you discover the rich history of nursing and provide the basic information you will need to grow and develop as a professional nurse. Knowing the struggle nursing has experienced with achieving status as a profession will help you to understand nursing's current role in healthcare. Professionalism is a concept that is both complex and multifaceted. Understanding the professional status of nursing requires an appreciation for the historical influences that shape nursing and the controversies surrounding the status of nursing as a profession. Although this is not a clinical practice course, it will be of interest to read background information about our history, not only to see where we've been, but by knowing our past, we can better envision where we might be headed. Nursing has existed throughout the history of humankind. From primitive to contemporary societies, care of the sick has been influenced by many factors, such as superstition and magic, Greek and Roman mythology, religion, male-female role prescriptions, legislation, wars, and other societal events. Male-female role prescriptions traditionally attributed the care-nurturing function to women. In the 3rd century in Rome, however, the Paraboni Brotherhood provided care to the sick and dying during the Great Plague in Alexandria, and early hospitals in India were staffed largely by males. The first sanitary legislation, the Mosaic Health Code, was contributed by the ancient Hebrew culture. This code differentiated between clean and unclean. In 1835, the Order of Deaconesses operated a small hospital and training school in Kaiserwerth, Germany, where Florence Nightingale trained. Nightingale went to the Crimea War with several nurses to provide care to the ill and wounded soldiers. As a result of a grateful English public, Nightingale opened her training school for nurses in London. The development of nursing in the Americas started with the Augustinian sisters in Canada. Mother Elizabeth Satan established the first American order of the Sisters of Charity of St. Joseph in Maryland. Throughout the history of nursing, individuals have come forward to influence the profession and society. Many of the names are familiar. Your text provides a great overview to provide a perspective of nurses as women and men, founders, risk-takers, and social reformers. The history of nursing is connected with the history of caring and the history of feminism. The basic roles of caring and nursing were often associated with women's roles of daughter, wife, and mother. Nursing organizations have developed to meet the professional needs of nurses and the healthcare needs of the public. There are several types of organizations. Organizations that represent and influence all of nursing, organizations that represent the need of nurses specializing in specialty areas, organizations that represent the needs of nurses of specific ethnic groups, and organizations that represent nurses' special interests. These are the main topics you will become familiar with in this first section of the course as an introduction. You will also start getting familiar with the syllabus, course policies, and getting to know your instructor and other students. Some words of wisdom as you begin any new class. Be sure to print a copy of the syllabus and the course schedule so you have them handy, as they answer most questions you might have, help guide you through the course, and of course the schedule will help keep you on track. Staying on track is particularly important in this class as much of the information builds on the previous chapters. Another helpful tip is that if you have questions, ask. We are here to help you succeed, and the earlier you clarify any questions you have, the sooner you are off to a terrific week. Remember, we are here to help you through this course and make sure you are successful. I have hoped you found this presentation interesting and informative and absolutely essential for you professionally as well as personally. Thanks, and welcome to Professional Role Transition. Happy learning!